Hello everyone. Today I will be talking about my proposal project, and the title of my proposal is an overview of the health effects on a 7T magnet for medical MR imaging. My name is Astreani, and my supervisor is Benjamin. So I will be starting with this picture. We are living in such epoch where the advancement of technology is rapidly developed. Let's say like gadgets, transportation, and also medical machines. But are we consider about the risk that might happen, or we just like accept everything and finally our health will be compromised? And here's the fact about MR. So both domestically and globally, the use of MR is rising, especially since 2014. The growth of the usage increases approximately 3 to 4% annually. Number of factors, including an aging of population and increased awareness of new MR capabilities. However, these days, more and more advancement and implants are coming on the market. Thus, the topic of MRI safety become really important to be investigated to prevent any possible danger. And the aims of this project are to report and summarize all safety aspects of high magnetic field MRI machines on human health, as well as to investigate the side effect and risk associated to 7T MRI imaging system. And my research plan is quite simple, so I do like extensive review on 7T MR machines on pregnancy. I will add this topic later. And here I will be talking more about pacemakers and implants. And the method that I use is as extensive reading on this topic on sources like Science Direct, Scopus, Google Scholar, and one search at UWA. So here the data of MR machine on selected country based on this reference, statista.com. So it's not like this is the only country that have MR, it's just selected based on the preference of this site. And the Japan numbered the most with almost 90 MRI per million population. So this is the units, the total units per million populations. And Australia is here, accounted for a quarter of Japan. So maybe in the future we can add more because MR will give us better diagnostic imaging. And based on the recent study, it shows that more than 1.4 million births suggest that MR is safe after the first trimester. However, the use of contrast agent causes more drawbacks, such as resembling connective tissue disease and a wider range of rheumatological, inflammatory, or inflammatory skin conditions. And these observations were conducted from birth to 4 years age. And this data I gathered from Canadian Birth Database in Ontario on 2015. Okay. And the benefit is to reduce the need for postnatal imaging, which is especially useful when an infant is vulnerable and unable to tolerate sedation. And this is the main point. The end result is to give a comprehensive review and a guideline for better protocols on MR. So what is MRI? I believe that all of you already know it, but I will try to give introduction on it. So it is a medical imaging technique used in radiology to form image of the anatomy and the physiological processes of the body based on body's proton density. So it's better to use for soft tissues like joints, brain, wrist, ankles, and breast. So here the advantages of MRI. The first is it does not use ionizing radiation but magnetic field, different to CT. And MRI acquisitions can be programmed to encode for various physiological phenomena. with also high level of contrast resolutions and more detailed. And finally, requires little patient preparation and is non-invasive like breaking. This is just summary how the MRI works. So the MRI will emit constant magnetic field and radio frequencies that bounce off the fat and water molecules in the body. Radio waves then transmitted to receiver in the machine, which is translated into an image of the body that can be used to diagnose issues. An MRI is highly adept at capturing image that help doctors determine if there are abnormal tissues within the body. And MRIs are more detailed in their image. To note that an MRI is a loud machine, so the patient should wear AirPods or headphones to make the noise more bearable. And also, they should lie still during the MRI scanner process. So here, I'm talking about the RF here. This device uses ultra-high field magnetic resonance imaging. So in range of this 868 until 915 megahertz, and these are the facts that I get. So actually, there is no severe effects had been reported about the UHF MRI, and maybe the worst case is causing vertigo. And why should we use 7T? Why don't use like 1.5T or 3 Tesla and combine it with UHV? So basically, yeah, maybe you already know that as the stronger the magnetic field used for the MRI, the greater fraction of protons will more become aligned. And the bigger energy difference between them and those that remain unaligned, as I said on the previous slide about how MRI works. This produces a signal that can be better detected over background noise, makes scanner highly sensitive to the slightest motion, so it can get a very detailed image. Some repetitive movements in the body caused by breathing or heartbeats can be modeled and removed. Yeah. So when we are talking about 7T combined with the UHV, it's such a blessing combination because it will make us get better imaging. So here are the safety issues to consider with strong static magnetic field, like biological effects. These effects include fatigue, headache, hypotension, and irritability. And we should consider about the compatibility of implantable medical devices as well. And IPAM recommends that all organizations that operate MR equipment for imaging of human subjects should appoint an MR safety expert. So here the talking about the acoustic noise. So during the MR scanning, gradient coils receive forces from high static magnetic field that cause the gradient coil generate high energy sound waves. To note that exposure to a loud noise can result in a reduction of the sensitivity of the hair cells in the organ of Corti and a shift in the threshold of hearing. This may be temporary if the cells can recover, or permanent if the exposure is very loud, like more than 140 decibel, and also with such longer time and frequent noise. So this is the fact about 7T MR. It's already gained approval from the FDA since 2009. And the main advantage of 7T MRI over the previous MR in case of hydrocephalus is that it can provide more accurate parenchymal changes. And also, but here the move from 3 Tesla to 7 Tesla presented some challenge, like biological effects that I already stated before, although it's temporary and are more pronounced. People can experience dizziness and vertigo when they move in and out the scanner. Researchers see, okay, when people move inside the machine, they can sometimes taste metal, see wild flashes, or experience involuntary eye movements called nystagmus. And some considerations should be taken into account for metallic implants, device, and foreign bodies in the 70 environment, because it's quite strong magnetic field. And these are the MRI during pregnancy. So basically, there are no proven risks to pregnant women or unborn babies from using MRI exams, but many facilities choose to delay MR imaging until after the first trimester. And it's the comparison between MR and CT scan. So we know that CT scan use electron density while MR using proton density. And because here we are using X-ray, it's like more risky compared to MR because the patient experience exposure to radiation. And as you can see here, the MR also provide like time dependent, so they can gather the image of the movement of the body. So here just like consideration that should take into account for patients, for pregnant patients before undergo MRI scanning process. They should free from brain symptoms and also cancer that requiring imaging, and also we should avoid using MR scanning for the patients with chest, abdomen, and pelvic signs and symptoms of active disease, and also this one in specific cases of suspected fetal anomaly or complex fetal disorder. So here, contrast agent. Basically, this help us to gain better imaging for MRI, but it's also have side effects. And these are the type of contrast agent, paramagnetic and superparamagnetic, and gadolinium is the most widely used. And here are the difference between brain scanning, brain imaging before using this contrast agent and after. You can see here tumor, you can see clearly. And in terms of pregnant patients, that study found that in general, intravascular contraception should be avoided in pregnancy in order to avoid possible hazard to the fetus. So here the side effect, so it can cause this side effect like the increase in bilirubin and blood iron, mild transitory headaches, nausea, vomiting, urticaria or rash, and in rare incidents can cause death. Between 1988 and 1993, approximately 5 million intravenous injections of gadolinium have been administered, and 17 cases of adverse events causing death had been reported. So it's better to not use the gadolinium during the MR process if it's possible. And in general, anaphylactic reactions are among the worst of the adverse events that a patient might experience, and anticipate using these agents. And yeah, it's just actually the ratio between the patient get these side effects is 1 to 100,000 to this number. So it's actually not see many cases, but yet we better avoid to use this gadolinium, this contact agent. So here are the implants. So basically implants is the metal that put within the patient body, and we know like metal can experience eddy current in magnetic field, so it's better for us to avoid it. Here's just examples of several implants. However, some implants are tested and show no deflection with the magnetic field, and it's gained the approval from FDA. So, but yeah, we still have to. I still have to like gain more information about this, because 7 Tesla is quite different with 1.5 Tesla or the other one, that the older version. And this, the pacemaker. These have all been cited in support of the view the MR examination for patients who have a pacemaker or cardioverter defibrillator must be avoided, since electronic device can cause severe effects in strong magnetic fields such burning. So pacemaker is electronic device, and the other one, the implants, are non-electronic device, but also it can influenced by magnetic field. But some pacemakers already get approval from FDA and labeled with MR conditional, and it's getting produced more and more since 2011, and it's including this device, but it's need more investigation on 70 MR for the compatible implants and pacemakers, because they might contain impurities. As we know that one of the cheapest metal that cannot be influenced by magnetic field is titanium, but it's so pricey, very expensive. So it is possible for implants or pacemakers contain impurities, and during the scanning process with high magnetic field can cause side effects like burning or heating the tissue. So that's all. Thank you.
Thanks, Aster. Any questions?
That's great, Aster. Thanks. You talked mainly about the patient and their effects. Are there potential effects on the staff operating the equipment and being around the magnet a lot? Have you seen any reports of possible health effects for staff?
Yes. I will try to read about that later, but in terms of acoustic noise, which is one of the effects of using MR machine, which is very loud, as we are around the MR machine and we experience a lot of acoustic noise, it also can harm for people.
Acoustic noise?
Yeah, that's the example. Yeah.
Mm-hmm.
Can bring.
And the other thing is, I'm not sure if they use a different coolant in the magnet for 7T, because it's a superconducting magnet. They use helium for 3 Tesla, but do you know if they use a different coolant at 7 Tesla, which might be a toxic material, might be something worth looking into? Yeah.
I haven't read about toxic materials, so I cannot tell about it. I will get this MR course next semester, so yeah, I cannot tell about it.
Any other questions?
I was just wondering, you mentioned both pre and postnatal scans.
Yeah.
Are you focusing on one particular subset
Sometimes the baby, the born baby, are vulnerable, so we cannot undergo MR. So it's better to get the MR scanning during the pregnancy, so before the baby is born.
So I think fairly basic one. So the topic of your project, is that just on the transition from like a 3 Tesla to a 7 Tesla, or is it a general review of the health effects of an MRI?
Yeah, it's basically one to give extensive review on the biological effects on 7 Tesla and also compare it with the previous MR machine, which is 1.5 T and 3 Tesla.
So now as you talked about stuff like noise, does that change much between?
Obviously, yes, because we use stronger magnetic field. Yeah.
Any questions from Zoom? Kat, do you have any questions? All good?
No, I'm okay, thanks,
That's
Declan.
fine. That's good. Okay, if there's no questions, just please join me.
Thank you.